we are working on a Pursuing Equity project for the Perinatal Services Trustwide. So it's across all the perinatal community teams, the mother and baby unit, and the Ocean Services, which is the service for people who've experienced any kind of trauma or loss related to the maternity experience. And the aim of the project was to bring together work that is being done in each of the teams around kind of health inequalities. We know that there's lots of pockets of work being done, but we wanted to kind of have some coordination around that. But also, as well as in addition to that, actually thinking about what we can do to improve our work around equities in perinatal services. We know that there's communities who are not accessing our services. What we also know as well is that from research that was brought out over COVID is that women from Black and Asian communities are significantly more likely to have a poor experience around the maternity periods. So their experience on maternity services of delivering their babies isn't always great, and also as well that they are they've got a 1 in 4 higher chance of dying during childbirth. With, I think in Asian women it's 1 in 5. So and that's in comparison to their white counterparts. So we know that there are inequalities in the NHS, and we also know as well that in mental health services that women from Black and Asian minority ethnic groups are also more likely to be detained. And what we know is that they'll also access services later. So that means that they might end up in inpatient services rather than, their experience may have been that they would just access community services. But for some women, it means they get detained and they end up on an inpatient service, and the outcomes, this means that outcomes can be poorer. QI is the perfect tool to use for this. I think it's such a huge piece of work and it can feel really daunting, and I think using QI and the Pursuing Equity kind of approach to this work has really helped kind of keep us focused and to give us kind of some processes in order to really think about how we're going to take this forward. Because I think when we first started meeting, it felt quite overwhelming because there's so much to consider. But as I said, this kind of piece of work, the Pursuing Equity as well, is really helpful to hear what other people are doing. So obviously it's not everyone's doing, working in the same area, but actually there's lots of learning that we can do from other services that are doing similar pieces of work. Is make a difference. I think we want to make a difference, but we also want to involve communities and people who have used our services and people who may use our services in the future, as well as kind of I guess voluntary organisations as well. We also want to include, so that specifically organisations who work closely with communities who are not reaching and who may not access our services. So yeah, the best outcome for us would be that people who need to know about our service know about our service and access it and have good outcomes, and that we prevent poorer outcomes. So for example, we prevent people having to go into hospital, or we're able to keep a family together where they may be at risk of being separated. I think that would be the perfect outcome for the services.